to www.agelesshealth2012.com for your special invitation.
Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's a pretty day outside, a little fallish, a little cool, but nevertheless, it is very pretty outside. Waiting for your phone calls at 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have in mind, no matter what it is, you've had a problem, you've tried, you've applied, you've tried to put the fire out and failed, well, guess what? Here's your opportunity to do it the right way. Give us a call, and we'll see if we can handle it at 888-630-9625. Have a very special program for you today and a very, very special guest, someone who was here with us before and gave you kind of a different look at the dental profession, at dentistry generally, and we're going to talk about a very, very specific subject, something that unfortunately too many people suffer from today, millions actually, and some of you are having to use appliances to keep yourself going. They scare you. They tell you that, if you don't fix this problem, that your heart's going to stop. If you don't fix this problem, that your mental capacity is going to stop. If you don't fix this problem, your immune system begins to fail. And either that or you walk around like zombies because you don't have any sleep. What am I talking about? We're talking about sleep apnea. A very, very difficult situation. And, some of you think that you got it because you're snoring, and some of you are diagnosed properly, and some of you have been told that you have this problem, and guess what? You really don't have it, and I've got an expert. I have somebody with me today, dear friend, my dentist, Dr. Michael Chung. Hi, Mike.
Hello, Dr. Roselle. Thank you for having me here today.
You're welcome. My pleasure. Always is. We have a lot of fun going back and forth, but this is a subject that is of special interest, not only in my profession because of what we deal with neurologically with these patients, but also in your profession. And the thing of it is that we have so many patients that sometimes fail to respond to sleep apneic conditions. And what we're talking about is the airway being obstructed. That when you breathe or when you snore, and if you're not getting enough oxygenation to the tissue, there's going to be a lot of damage to the body. This is something that you see very commonly, yes?
Yes, it's very common. Like you said earlier, millions of Americans suffer from this.
Mike, so when a patient comes in and they see you for whatever type of dentistry, and your specialty is neuromuscular dentistry, so you have an intimate knowledge and relationship to how that temporomandibular joint works in relationship to the neurological system of the body and all the ramifications. But you see these patients and they come to you for whatever they're coming from you. Do you know just by history, or can you tell by examination that the patient may have a potential, not an absolute diagnosis, but a potential problem with sleep apnea?
Yes, actually both, all of the above that you spoke about. It's usually clinical examination as well as a brief history of what the patient is telling me. And usually they'll have some form of symptoms of, not being able to sleep well at night, and so they're very sleepy throughout the day. They may be fatigued, less energy. Their depression may actually get worse. They may start to have some form of heart issues. Diabetes usually gets more complicated. So there may be many symptoms during questionnaire can come out.
So a lot of constitutional problems that show up relative to intake, and I know you do an extremely thorough intake and appreciation of the patient's history. With these type of patients with sleep apneic conditions, from our point of view, we see a lot of patients that come into our practice with previously diagnosed sleep apneic considerations, and they're on CPAP units, which are ridiculous and cumbersome and forcing oxygen into their system, and they just don't sleep well. They may wake up with more oxygen pushed into their body, but they don't sleep well.
That's correct. The CPAP machine works great for someone who may have extremely severe sleep apnea, but in most cases, mild to moderate to some severe cases, just an oral appliance can do the job, because it's usually a restriction of their airway in some form, mostly the tongue or the soft palate and the uvula being oversized and is basically closing off the airway that's causing this. So a lot of times if just opening up that airway with some form of mandibular stabilization with an appliance can do the job without such a bulky, cumbersome, and noisy unit.
Well, we're gonna get into that, because I know you use a very special appliance, and there's many out in the dental field, and you hear a lot of guys advertising about sleep apnea and come in and do this and so forth. But you have a unit that I'm very impressed with, and one that does, in my opinion, a far better job in stabilizing sleep apneic situations. I know. If I had that problem, which I don't, fortunately, that there's no way that you're going to get me to comply using a CPAP. It's not going to happen. I travel too much. I'm not going to pack it. I'm not going to do those things. But there's other devices. And, from our point of view, when we see a patient like that, we look at the innervation to the soft palate, to the tongue. We're looking at cranial nerves, the hypoglossus, so we know when there's injury to the upper portion of the neck that these tissues are affected. Sometimes they're affected with allergy reactions and so forth. But there are oftentimes, and going back to your specialty of neuromuscular dentistry, the appreciation that you have for the position of how the teeth, and I want to talk about that just for a minute. We're going to get into the appliance. We're going to get into how you diagnose these things. The position of the mouth relative to the neurological innervation is critical. And
yes.
It has a profound effect on the soft palate. It has an effect on the tongue. Let's talk about it just for a little bit, because I know you've been trained through LVI Institute out of Las Vegas, and as far as I'm concerned, one of the most cutting-edge institutions around. So let's talk about that just for a second.
Sure. I mean, actually, there's a strong correlation with neuromuscular dysfunction patients with sleep apnea. Most of the times they'll be retrognathic, meaning their lower jaw is further back and pushes their tongue and all the soft tissues even further restricting their airway. So they're more inclined to have sleep apnea issues. And actually, most patients don't even know they have sleep apnea, by the way, and the only way they can usually tell is because someone of their family or their sleeping partner would let them know that they had, noticed that they were not breathing properly or they're snoring really hard, and which are all signs of disruption of airflow. And that is, properly the way to diagnose that. And once they know that, then they'll have to seek a professional where they can actually do a actual home sleep study where they can actually measure the oxygen saturation as well as the number of snores and number of actual restrictions of sleep apnea moments.
So you can do this, you can do the sleep studies in your house?
Yes, so that's one of the issues of compliance from patients before is that they had to actually go to a sleep center and be hooked up to 20 different wires and in a uncomfortable place where they don't know. And it was hard to get patients to comply to that. But now we actually have tiny computer units that you can actually take home, and you sleep with it right at home in your own comforts of your home, and it will measure just about everything that we need to know to diagnose sleep apnea.
Wow, what a fantastic situation that is, because so many people, they come in the office, well, I've got to go to a sleep center. I got to go do this. I got to go do that.
Right.
And it's just because of that, you're going to have low compliance. And then after that, the follow-through is something that is less than something that the dentist or the doctor would want. But now we've got the ability to study oxygen flow and tissue saturation in the home, in your own house, so you actually can sleep and you're not being interrupted by a strange environment.
That's correct, and they're actually able to get a good night's sleep.
That's huge. That's amazing. And actually, when we're going to talk about it in a little bit, I know that you're going to offer a very, very special consultation, including measuring oxygenation at home at no charge, because I twisted your arm a little bit and made you do it, but hopefully...
Anything for you, Dr. Roselle.
Hey, listen, it's a mutual exchange, my friend. But nevertheless, sleep apnea conditions are things that can be reversed if done properly. And I know they can be reversed by doing the type of work that you do. I know they can be reversed in many cases by doing the work that we do in balancing the neurological system and making sure that the allergy reactions and the biochemical balances are normalized. And we've worked hand in hand with that over a period of time. Let's talk a little bit about the actual process of how you handle a patient like this, and from suspicion, if you will, to diagnosis. Let's walk through that a little bit so our patients or our audience really understand what it is that we're talking about. First, obviously, we're talking about sleep apnea and the very unfortunate side effects of that condition, meaning heart problems and mental capacity and energy and so forth, meaning probably the top three. Shortening of lifespan, obviously, because of all those things.
Right.
But let's talk about a little bit how we diagnose that from your point of view.
Well, basically, if they have any suspicions or they've been told by a family member that they may have sleep apnea, then obviously the first thing to do is consult a professional that can further question them. And it's not a blood study. You can't really pick this up on any kind of blood study. So it would be a pretty thorough history is one way, but we can usually also tell by clinical signs and symptoms of their the pharynx. If you look inside their mouth and see their jaw, and we can usually have some suspicion of that. But only way to really confirm it is to actually have a sleep study done. Then we can totally measure how many actual apneic events that they may have, as well as hypoxic events that they have throughout the night. That would be the only way to actually diagnose it. But normally, if they have moderate to severe sleep apnea, then we would normally consult an actual medical sleep expert to be able to help us diagnose that.
The diagnosis of this is critical, and we referred patients to you for this and over time, and the results are significant. I'm going to talk about how you treat that as we get into it. But Dr. Michael Chung has offered for all of Dr. Tom Roselle Live listeners to do a complimentary, not only consultation, but Dr. Mike has graciously offered to be able to send you home with the diagnostic equipment to measure oxygen saturation and to measure whether or not you in fact have a sleep apneic problem from the interruption of the sleep pattern at absolutely, now get this, absolutely no cost to you whatsoever, zero. All you need to do is call him at 703-319-6990. Mike's office is in Oakton, Virginia, on 123, just off of Route 66, probably a half a mile, maybe less.
Yes.
Soft touch dentistry, but Dr. Michael Chung, and he's willing to do that for our listeners. And just call him up and say, hey, listen, I heard you on Dr. Tom Roselle's program, and I'd like to come in for that offer. But it's a huge value, and it's amazing. Thank you. That's
it's
very, very generous of you.
It can change someone's life. Not just change it, but maybe save their life. So it's something that I think we as medical professionals can help the society.
This doctor that is sitting here with me in the studio, it has to be one of the most generous and caring human beings I've ever had the pleasure of meeting. He is not only giving, but he's incredibly bright, and his ability and understanding in the area of neuromuscular dentistry is above the cut. And take advantage of this. He's willing to talk to you. He's willing to consult with you, do a history on you, send you home with the appliance. And, you can't get it anyplace else. Give him a call, 703-319-6990. Dr. Mike and I have been friends for quite some time, and every once in a while I've got to twist his arm a little bit and, to open this up because we do care about you. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live here in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Want to remind you, coming up a week from yesterday, the 20th of the month, Ageless Health 2012. If you haven't registered, you only got a couple days, so pick up the phone and do it. Remember, this is a day that can change your life, that can turn things around for you immediately. We're going to send you home with a tremendous amount of information. You get to take home all the data. You're registered for $1,000 worth of health care at the Roselle Center for Healing. Everybody has a shot at that. There's some giveaways. There's some vendors, all kinds of wonderful things that are going to be there. But more importantly, the information. How to live well in a stressful world is the topic this year. It's the theme. Dr. Evan Mladenoff is our guest speaker from Kansas City. Dr. Evan and I have known each other for over 30 years, as much as I don't want to admit it. But nevertheless, time does travel quickly. And he's going to be talking to you about the emotional side of healing. A master lecturer, a master presenter, a master practitioner. Call 703-698-7117 or go online at rosellecare.com. That's ROSELLECARE.com. Take advantage of the online special so you can save a couple dollars. We are almost at capacity. I would not hesitate. Don't wait. Give us a call. In studio, Dr. Michael Chung is my guest today. We're talking about sleep apnea conditions. Dr. Chung is a dentist, and he did his undergraduate at Johns Hopkins, did his dental work at University of Maryland, and also spent a couple years in the Navy before he went into private practice and has been at it for a long time. He has a specialty in neuromuscular dentistry, so he understands the subject intimately, far better than most people ever will. So, Dr. Michael, again, welcome, and let's talk a little bit more about sleep apnea conditions. We know that it's devastating. We know that people can ultimately shorten their life because of the lack of oxygenation to the tissue and heart problems and diabetic problems and so forth, let alone feeling tired all the time. But, we have only one way medically right now, other than what we're going to talk about today, which is amazing. People going out with these big units, and they have to carry them anyway. And I know you have a lot of comment on that.
Yes, you're referring to the CPAP machine, and it's basically a positive air pressure machine, and it forces air down your throat. So, it works well, but for most patients, they have a hard time falling asleep because it is noisy and it is large, and it is impossible to travel with because it's such a big unit to carry around. Things have improved and things have gotten smaller, but either case, that is the number one issue with CPAP is compliance. So one way to actually increase air pressure or airflow is with an actual dental appliance, specifically an appliance called the TAP appliance, the Thornton appliance. And it is the only appliance that can actually be titrated as well in the sleep center to the exact position. But how we normally would make that, and by the way, there are 20, 30, 40 different types of appliances out there, and not all of them are equal. Some you can even buy it over the counter. And I certainly would advise people from just buying one off the counter because you can actually do more damage than good.
I was going to say that if you use a dental appliance that is not fit for you, you can actually destroy the temporomandibular joint. You
can not only do that, but you can actually decrease the airflow and actually do more harm in terms of the airway.
Because the whole idea is to pull forward so that the palate doesn't drop against the throat.
That's right.
And obstruct the airway. And you want to keep it in a position where the airway is open, and the patient basically creates its own positive pressure.
Right. But the problem is, and we know this because we actually have a pharyngometer that can actually measure the actual volume of air that's going through as you're inhaling and exhaling. But just because you bring it down and forward, not everybody gets better airflow. Unfortunately, there is an optimum position that can be custom fitted for each person, and it can only be measured by the pharyngometer. But you can actually bring the patient too far forward, and you can actually decrease the airflow there as well. So it's not always just forward. There's an optimal forward or downward position.
And you can do that all by computerized models, is that right?
Correct.
And that's part of what you do with neuromuscular dentistry. I mean, the effect that you get in your office with patients in stabilizing the temporomandibular joint and the neurological networks of the body is absolutely impressive to me and always has been, and you do such a phenomenal job. When we come back in the second half, I want to get into what the appliance does, how we actually do that, and I want to reiterate again that you are an amazing, generous human being, and for Dr. Tom Roselle's listeners, you've extended the ability for them to come into your office, a full consultation history, but also you're willing to send them home with the appliance, not the appliance, but the
Metabite Junior that can actually do the home sleep study.
And they can do it there.
They can be diagnosed, because they're unless you do that, you really don't know whether you have sleep apnea or not because you're asleep.
Give Dr. Michael a call, 703-319-6990. That's 703-319-6990. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625, 888-630-WMAL, broadcasting to you from 105.9 FM and AM 630. WMAL. Love to talk to you on any subject, but we've got one today that I think is fascinating. It's called sleep apnea, and I've got a guy who knows it probably intimately better than most people do, Dr. Michael Chung. Dr. Chung is a dentist out of Oakton, Virginia, and operates a place called Soft Touch Dental. And Michael, before we get into a little bit more, I want to get into this intimately for our readers, because sleep apnea conditions is a condition that is really devastating to some people. The problem is that, and we see people coming in, I'm tired, I can't seem to get around it, and we look at it from a neurological as well as biochemical vantage point, but in some situations, there's a whole lot more to look at, and what I want to ask you as we go forward is how much of the sleep apneic presentations are pure dental, and because of bad dentistry, if you will, and messing up the TMJ. But I also want to talk to you about the TAP unit, and I want to get that intimately, and particularly because of the very special offer that you've made to Dr. Tom Roselle's listeners. But let's go to the phones. Bessalina, are you there? Or Belsina? Belsina?
Yes.
Hi.
Good afternoon.
Good afternoon. How can I help you, my friend?
Yes, I'm trying to find out if from upper side is good for you.
Oh, okay. That's a real quick answer, and for most people, it's a general. It can be, as long as you're not allergic to apples, as long as you get an organic form. The best form is Bragg's apple cider vinegar, and the best time to take it, if you're using it medicinally, is in the morning on an empty stomach. You take 2 tablespoons of organic apple cider vinegar and a little bit of water and drink that. And what it does, even though that it's a slight acidic substance, when you ingest it, when it's absorbed in your body, it actually converts into an alkaline form, and that's what you want. You want the alkalinity because it begins to decrease the inflammatory pathways within the system. So if you're not allergic to it, it's not going to hurt you, but like anything else, you don't want to do it every day the rest of your life. You cycle things like this. You may do it for a few weeks and give yourself a break for a few days, and then you can get it back in for a week or so, then give yourself a break for a few days, and it should help. So, Belsina, I hope that answers your question. I appreciate it, and thank you for your call. We have another caller, but I'm going to answer that question, Michael. I'm going to let you answer it simply because it's straight up. We have a caller that had an implant done and a crown apparently, and the color is not the same as the rest of the teeth, and she wants to know why. Is there a problem? Is that common? What happened?
Sounds like to me that there was probably a miscommunication between the doctor and the lab. Usually it's simple as just having the color communicated to the lab that the doctor wishes for, and usually they can also send a picture together so that they can match the color better. And in some instances, if it's a very difficult shade matching, they can even send the patient to the lab if it's local so that the technician can actually take the custom shading right there.
Okay, that's, straight up. My brain says somebody didn't match it because it's very easy to match one to the other. You have to have the color chart, and you have to do it in consultation with the patient. And if that doesn't happen, call the dentist and say, hey, listen, this isn't working. We have a few more calls. We're going to get to those in a second or two, but more importantly, let's talk a little bit about obstructive, central, and mixed sleep apnea conditions. There are many kinds, and simply we're not going to get into them in depth, but what my pure answer or question to you is, which one's the most common, and which one is the one that's being treated most often, and you fill in the blanks, my friend.
Yes, well, central sleep apnea is a less common type of sleep apnea, and this disorder occurs because the part of the brain that controls your breathing doesn't send the correct signals to your breathing muscles, and so it's basically having moments or sometimes even minute of no breathing. That could be very dangerous. It is less common, and it's usually caused by some medical disorder, or certain medications can cause that. But most common one is obstructive sleep apnea, and that's purely disruption of your airflow and sometimes complete restriction, and you'll have moments to even couple minutes of no breathing, and it's a constant cycle throughout the night where you may be snoring heavily, and then because you're not getting enough oxygen in your blood, your brain will basically wake you up, and you'll have moments of like type of struggle and gasp, and you go through this constant cycle throughout the night, so you don't get a good night's sleep, and of course you wake up tired and fatigued, and it's also can damage your whole cardiovascular system, cause diabetes, depression, many side effects.
And so many patients will come into our practice and they say, it doesn't make any difference how long I sleep, but I don't sleep well, meaning that I wake up through the night, I'm going back and forth. And we look at it as an adrenal function problem as well, because when blood sugars crash during the middle of the night, it's going to wake the patient up, and that's one of the things that have to be ruled out. But setting all those things aside, when the posterior pharyngeal palate, the back part of your throat, the pharynx area, is not being facilitated, if you will, being neurologically stimulated properly, or there is another obstructive mechanism that is causing it to lay flat, so you can't get the air. So another question is simply this. Bad dentistry. Patient comes in, and you see that all the time, because in neuromuscular dentistry, your specialty, when a patient's vertical dimension, meaning the height of the temporomandibular jaw as measured from the upper denticula to the lower denticula, is not normal and is not equal throughout, you have all kinds of neurological ramifications. But specifically to sleep apnea, how much does bad dentistry contribute to this?
Well, I don't think there's any studies out there that gives you actual numbers, but in my practice, I would have to say it's a pretty high incidences where not just bad dentistry, but just they may be genetically predisposed, where they're, like you said, the vertical dimension is too low, and that would further close off the airway. So usually the patients would have narrow, high palate. They would have retrognathia, where their lower jaw would be retruded, and that would further retrude their tongue and the soft palate and the uvula. All these things contribute to decreased airflow and make sleep apnea that much more worse.
So the diagnostics that a patient goes through when they come into your practice is one where obviously history, and you're going to do a general exam, but then you're going to send them home with the ability to be able to measure absorption, measure how many times that they stop sleeping through the night, to see if there's an obstructive process.
Correct. It will count the number of snores and so on.
So they don't have to go to a sleep center. They don't have all of that encumbrance. They don't have to put their life off. They can do it at home, and they can do it quietly.
Yes, they can conveniently do this at home. They would just go to sleep like they normally would, and just attach a couple things. They would wear this appliance like a necklace, and put a little thing on their finger, and when it wakes up, they bring their computer back to me, and I can plug it into my computer, and it will give me a full report on a sleep study.
I mean, those of you who've gone through the sleep center studies know how inconvenient it is, and you know how much of a pain in the lower extremity it can be. And it disrupts your life, and you don't sleep anyway because you know you're being watched and monitored and so forth. You're not in your own bed. What an amazing capacity to be able to do this in the privacy of your own home. And we're intimate with it. We understand the process. We understand the study from not only what they do traditionally medically, but also what Dr. Chung does in his practice. And after a little conversation, we got Dr. Chung to say yes and offered very graciously to allow you to come in, Dr. Tom Roselle's audience, to come into his practice and take part in a sleep study and consultation and brief examination at absolutely no charge whatsoever to you. I mean, that is huge. Michael, thank you. I mean, that's amazing. And all you need to do is give him a call, 703-319-6990, 703-319-6990, and tell them that you're a listener of Dr. Tom Roselle, and they will hook you up, make an appointment, and send you home after an examination with the information. And then it's up, to you in consultation with Dr. Michael to decide, the approach that you're going to take. But if you've been hooked up to a CPAP unit, or your doctor's talking to you about it, or he wants you to do a sleep study, or any of those things, it's like, take advantage of this. This is amazing. Let's go to the phones. Linda, how can I help you?
Oh, thank you. About a year ago, I had a thermography done, and it showed that I had a mild increase of thermal activity in the left carotid artery, and it may relate to the, inflammation. We checked my CRP, and that was fine. It also said it could be to some degree of unilateral vascular occlusion. So I'm going to be checking with my cardiologist here next month, but how do you know what the root cause, if this is, I have Hashimoto's, how do you know what the root cause
You said you do have Hashimoto's?
I do have Hashimoto's, and I suspect that I may have sleep apnea as well. I've had a sleep study. Nothing came of that sleep study because I didn't sleep very well, as you just mentioned.
Okay, by definition, the fact that you have Hashimoto's indicates that you have a high-level inflammatory response in your body, period, end of story.
Okay.
It's an autoimmune response that part of its presentation is inflammatory condition. So what you do is you look at the structural piece. For example, I'll give you another indicator. If the cervical spine, the neck, is out of position. In chiropractic, we call it a subluxation. In osteopathy, they call it a cervical lesion, but it just means that the vertebrae are not positioned. Now, remember, the nerves that come off the spine go to the muscle systems, but they also go to arteries, they also go to lymphatic areas, they also go to organ systems. So if there's a dampening, a decrease of the neurological flow, causing the artery not to be able to move the blood through it the way it's supposed to, that's going to result in a hot area. And remember, what thermography does is it identifies increases of and decreases of heat within tissue, okay? Mm-hmm. And so it's a blood supply type of condition that's identifying. So you have multiple things that it could be. One, we know that you have an inflammatory response. Two, that inflammatory response and your Hashimoto's problem can come about because of allergy reactions, environmental, toxic reactions. Even in Dr. Chung's field, it could be because of mercury in your mouth and that your body's reacting to that. So there's many things that have to be unveiled to find out what it is. Once you have, a baseline diagnostic with your cardiologist, if you would like, get a hold of me at rosellecare.com. Send me a note, and I'll be more than happy to, give you my opinion and tell you what I think you need to do as the next step. So, feel free.
Okay, that sounds great.
Linda, thank you for calling. I really appreciate it.
Thank you so much.
Thanks for listening. So, Dr. Michael, let's we're coming up to a break. We have about a minute, but what I want you to talk about a little bit is the importance of this Thornton appliance and why it's so effective, and what is the effectiveness rate of it. We got about a minute, Mike.
I would say it's very effective. Only in the very extreme, severe cases, it may not be as effective without a CPAP, but it is the only appliance. There are many appliances out there, but it can be extremely custom fitted to the exact mandibular position that we're looking for to stabilize the mandible as well as their tongue and their soft tissue. So it is highly effective if it's done properly. And we can specifically measure that with the pharyngometer. And in some cases, we may do another sleep study afterwards to check the efficacy of that position.
You know, there was a 2-year study done at the University of Texas by a guy by the name of Dr. Paul McLorman on this TAP unit, and the effectiveness, as they reported, was absolutely over the top, so that's encouraging. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon bringing you the most cutting-edge information on integrative medicine from many different vantage points. 105.9 FM and AM 630 WMAL. That's where you find me, and when you want to talk to me when I'm not here, you go to rosellecare.com. That's ROSELLECARE.com. And don't forget, next Saturday, Ageless Health 2012. So if you haven't registered, no longer wait. Don't hesitate. Give us a call or go to the website and register online and save yourself a couple pesos. My guest in studio has been Dr. Michael Chung, an amazing neuromuscular dentist. He owns and runs Soft Touch Dental in Oakland, Virginia. And Dr. Chung has been extremely gracious with a little arm twisting from us to offer Dr. Tom Roselle's listeners an opportunity, because we know that sleep apnea is a problem that can take your life and shorten it and decrease your energy, and you all deserve the best. So what you need to do, if you'd like to find out, 1, if you do have a sleep apnea condition, 2, if anything can be done about it without surgery, without those crazy CPAP machines that you have to lug all over the place, with a very simple tap device that can be equilibrated, I stumbled on that, Dr. Michael, but to your specific dimensions, then what you need to do at absolutely no charge to you, and do the sleep apnea study at home on your own without any charge, no charge to you or your insurance company, 703-319-6990. That's 703-319-6990. And, you know, I don't do this except when I think that it's something that will serve my listeners. You know, Dr. Tom Roselle Live or the Roselle Center for Healing has nothing to gain by this one way or the other. This is for you, because we seriously believe that this is a problem that can be rectified, can be solved, but we need the help of people like Dr. Michael Chung. So give him a call, 703-319-6990, but make sure you tell him that Dr. Tom Roselle told you to give him a jingle. Michael, real quick, you got about 30 seconds. Talk to us a little bit more about these the TAP unit and how important this thing is.
Well, for sleep apnea, basically our main goal is to keep the airway open so that breathing does not stop during sleep. And we found that this TAP appliance is probably the most accurate way of keeping that mandible stable in the correct position so that they can have a positive airflow. And it is very effective.
Michael, thank you again. I appreciate it. I appreciate your presence. We'll have you on the program again at some other point, and we'll talk about another subject. But next week, Saturday, Ageless Health 2012 at the Fairview Park Marriott Hotel. Come and see us. Join us. I promise you it will be a day that you will never forget, and you'll be able to implement the information immediately the very next day. And I will always be here every Sunday, 12 noon. This is Dr. Tom Roselle. See you soon. Bye. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply, MRI and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117.